You're listening to the Turn Autism Around podcast, episode number 223. Today, I have my friend on the show, Risca Solomon from the UK. She is a BCBA and founder of Skybound therapies, which provides ABA, speech, and OT therapies in the UK. She has a center on a farm where she brings in clients from all over the world to do 5-day consultations. She also does outreach in the UK and beyond. Riska is passionate about improving the lives of individuals with developmental disabilities and started out with trying to help her brother who was in foster care with her family. And that really led her to doing all of her work and becoming a BCBA. So I met Risca in person 8 years ago when I was in the UK presenting, and she and her team were really positive and just had a great time presenting with them. So I wanted to have Risca back on the show. Today we're talking about her journey, but also really diving pretty deep into the role of behavior analysts who can learn tools to improve speech through a oral motor program called Talktools. So we talk a little bit more about that than on most shows. We also talk about fluency and just how to collaborate with speech pathologists to improve speech. So let's get to this important interview with Risca Solomon. Okay, Risca, it is so nice to see you again. Thanks for joining us today.
Thank you. Pleasure to be here.
Yeah, so we met about 8 years ago when you invited me through your company, Skybound, to come to the UK to speak. And I've been following your work online since then, and you're really just a real pioneer in the field. So I want to start out with your fall into the autism world because it is very unique.
Yes, so my parents began doing respite and foster care for disabled children when I was 11 years old. And we had a lot of children through our doors, but they always said they never wanted children, particularly with autism, because they didn't feel they could necessarily handle the behavioral difficulties and things, because they had some friends and things that had a child with autism that was quite challenging. And then somehow more children with more autism sort of features at that time started coming to visit. But then I also did some work experience in the local special needs school and happened to meet a child there called Dan, who had a lot of very significant needs. Whilst I was waiting to go to university, I did this work experience there. And then I also got a part-time job with a charity called Bernardo's that did support work. And again, at that charity, I met Dan again and sort of said, well, I know him already. So they started asking, would I do some work, some support work, taking him into the community. And then I begged my mum to let us do some respite care because he was looking for a respite family. He only came for a couple of nights. He was 4 years old, had very severe autism and a lot of other difficulties as well. And he came for a couple of nights across a couple of weeks. We were due to have him sort of once every fortnight for an overnight to give his mum a break. And after about the second night, we had a phone call saying, don't take him home. And unfortunately, after that, he rarely went home after that. That was 22 years ago now. And it turned out he wouldn't be able to return home due to the complexities of his mother's situation. So he has been in our family for 22 years. He just turned 26 last week. So he just shaped everything really, because I started looking at what interventions we needed to help him and to be able to keep him within our family, because he was so challenged and so challenging. He was so aggressive, not toilet trained, no communication. And it had to go through a care order here in the UK that to make it official that he wasn't going back to his parents. And then we applied to officially long-term foster him. And then my parents eventually applied for a special guardianship order. And then when my husband and I got married and bought our own house, we applied to be as respite foster carers. So he's always sort of gone back and forth between my parents and ourselves. And we're very fortunate now to live on 2 farms next door to each other. So he still comes back and forth between us. But in the search for finding how we could help him, I really got hooked on behavior analysis. Luckily, locally here, we had a family doing behavior analysis local to us that used to have Vince Carbone come over as the consultant. So got to know all about ABA, saw Vince every sort of 6 months and just fell in love with it. So then went on to do the master's at Cardiff University. But it was all really to try to find what we could do to help Dan.
Yeah. And Lucas is 26 years old too. So very similar in terms of me trying to help Lucas, me trying to find, techniques to help Lucas, and then eventually finding my way to help other kids. So we have had a few foster families join our online course and that sort of thing, but it seems to be that kids, especially with very challenging behaviors, there's just not a whole lot of placements, whether you're talking about the US or the UK, or it is certainly such a challenge. And so, go ahead.
Very, very challenging, because the social workers are out of their depth oftentimes when it comes to these individuals with such complex needs, and the level of support within the statutory services we found was just quite poor with helping us with those complex needs. And of course, they didn't know how much sort of trauma Dan had experienced, because nobody really knows what went on for the sort of first few years of his life. So there were a lot of complexities, and we just couldn't really get the answers. And it was only when we started to really delve into behavior analysis and we began to fight for funding then to get a behavior analysis program for him that, we've managed to find a path and a way through, and felt empowered then. But we still had to fight all of the system then to be able to get that funding. And as foster families, you're sort of fighting with one hand tied behind your back as well, because you haven't quite got the same rights as biological families. So we had to also learn all the laws and the technicalities of being a foster family, and what we could fight for and what we couldn't fight for and things. But in the end, we found our way through the system and managed to make the system work for us. But it has been difficult. And even when he got to 18, because we were special guardians by then, my parents were special guardians at 18, we would have had no rights at all. So then we had to go through the system then to become legal deputies. So myself, my mum and my husband, all 3 of us are now his legal deputies, so we can make those decisions for him.
Yeah. We got guardianship for Lucas when he was 18 as well. So in the United States, the same thing. It doesn't matter how disabled the child is, he like at 18, we wouldn't technically be able to get medical information about him, even though he can't converse, he can't make a phone call to find out for himself, he can't cross the street, he can't stay home alone. We had to get a lawyer, go to court, spend, $1,000 or more, and get legal guardianship, which is like a whole nother animal, and we've done very few, we haven't done anything on guardianship, I think, on this podcast. But it is a real problem. So that really led you to become a behavior analyst, but also to found your Skybound center, which is a multidisciplinary center. And now you tell us about the center and what you do and where it is located.
So I really didn't have a plan to run a business at all, just had a plan to become a behavior analyst and help Dan and a few other children. But we really wanted to help Dan to learn to talk. And so we looked all over the place to look at, what were the difficulties, because he babbled, he made lots of sounds, but using ABA alone, we could only get control, get echoic control of 3 of the sounds.
By what age was that?
So that was, we started ABA at 7, and this was sort of 10 and above. This was coming up towards 12, that I was still sort of thinking, well, there still must be something out there, because, he's learned to do everything else. And actually, it was a BCBA that we knew at the time that said, well, have you looked at Talktools? And then I went to Tamara Casper's workshop. She was over here presenting. And right at the end of the workshop, she said, well, you need 5 sounds to start this program, but if you haven't got 5 sounds, have a look at Talktools. And so,
so let me interrupt real quick. So we have a podcast episode with Mags Kirk all about Talktools. She's a SLP BCBA. I met her actually when I was in the UK in person. She took my online course in the very beginning. So that's a really good introduction to Talktools. We're going to be talking more about Talktools. And also Tamara Casper is a SLP BCBA, and she was on the podcast talking about praxia and autism. And we can link both of those in the show notes. And these show notes will be marybarbera.com/223. So
great.
Go ahead.
And so we found out about Talktools and some tactile cues and things, and I started posting the progress Dan was making with ABA and these extra speech interventions. Started posting some videos on YouTube, and it was quite amazing. Within only a few months, we went from sort of only 3 sounds to him trying to say whole words, him trying to use words for manding. And it just took off. It was unbelievable, the amount of people that were then contacting me, asking us to provide consultation and support. And also in the videos, you could see the setting that we live in, which is a farm. We're on a 120-acre farm here. It's only a small farm, but people could see how much we were using that setting with Dan, and we were able to work on appropriate walking and being appropriate around bodies of water and things like that. So we decided to try and do a farm diversification project and open a centre here on our farm, where we have families come in usually for 5 days. So Monday to Friday, they come in for intensive therapy. We only have 1 family here at a time. And so they work with our behaviour analysts, our occupational therapists and speech and language therapists. And we are very hands-on all week. So some families bring staff with them, bring behaviour therapists, etc. Other families just come themselves and the parents, and we work with the child all week. We do a lot on feeding, a lot on speech, a lot on toilet training. We do whole program reviews, whatever that child needs. Some families come for 1 week just because they want to tackle one particular issue. Other families might be coming 3 or 4 times a year, and we might even see them in between. They fly in from all over. We've had families in from India. I think we've got families booked from Saudi Arabia. We've had families booked from Canada and all over the place to sort of fly in for that special services. And some of the families fly in for 2 weeks at a time and things.
Wow.
So we have that as our sort of centre, and then we do a lot of outreach consultancy. So we've got, I think at the moment we are on target to have about 14 BCBAs by the end of the year. So at the moment, I think we've got 9 or 10, and we provide outreach consultancy and do sort of home programs, school programs, and as well all over the UK then and abroad. So we cover Belgium a lot and Ireland and all over the place.
Cool. So, I mean, that's amazing that you can bring families in. I know the Carbone Clinic, when they were open in New York, used to do that. Used to have like 3-day consults and that sort of thing. So you can make a lot of progress in 3 or 5 days, 5 days, 2 weeks, and I'm assuming that the parents are pretty involved when they arrive with the child.
Yes, so we like one parent to stay the whole time, because the main aim is for us to, put the interventions in, test all the interventions, make some progress, but then hand over to the parents. So we coach the parents, use behavioural skills training, and hand over to the parents by the end of the week, so as they're confident going back home.
Yeah. So let's talk a little bit about like the speech and feeding work that you do with your clients, and you did with Dan. And I just interviewed, I think 220, podcast 220 with Dr. Barbera, who is the author of the ESA. And I mean, she's just a wealth of information, but we really didn't talk about the correlations between feeding and talking. And I think that's related to this Talktools. I know you're certified in Talktools, and you are, so why don't you, for our listeners who don't know what Talktools is, why don't you tell us what it is, and like how you're certified, or the fact that you're a behavior analyst certified in really a speech kind of tool.
Yes, so I am certified to level 4, and I teach for Talktools, mostly around just pure, just autism. I don't necessarily cover all the other disabilities with regard to the Talktools and how it's used. But what was fascinating to me was when I realized that Talktools had task analyzed every sound that we make, as well as all the movements needed for feeding, and had broken it all down into the individual behaviors that are needed. So where does your jaw need to be? Where does your tongue need to be? Where do your lips need to be? And what does your voice need to be doing? Is it voiceless or voiced? Is it nasal? And so what Talktools have done exceptionally well is task analyze each of those sounds and the movements for feeding. And then they've developed lots of different programs and tools to be able to prompt the child into those positions. So if you want a child to be able to say the sound, they need to be able to keep their jaw up high. They need to be able to close their lips. They need to be able to send the sound nasally. And so if they can't close their lips, if they haven't got that fluent, then we're not going to be able to get an echoic from them. So we need to first work on making sure that they can volitionally close their lips. So Talktools have lots of different tools and techniques. They have a sensey lip press that vibrates. So they have a lot of different tools with a lot of different prompts. You can have vibration prompts, you can add texture, you can add food, all of those sorts of things. So they just have this amazing selection of tools that you can then use to find what will prompt that child to do the movement you need. So if a child can't say the sound, there's all different tools and programs that you can use to be able to teach the child first the movement, and then how to put it into speech, and then how to put it into speech functionally.
Yeah, so way back, probably in 2003 or 4, I started learning about Talktools, and I never used Talktools for Lucas because Lucas always had speech. But I had a friend whose speech therapist used a little bit of it, and I started looking into it after I was a behavior analyst. And in my first book, The Verbal Behavior Approach, I do actually mention Talktools as an option. And actually, I've gotten some flack for that way back. Flack from speech pathologists who don't, quote unquote, believe in it. A lot of flack from behavior analysts. I mean, most behavior analysts do not think that working on, this is, and I'm glad we're talking about this, because I think behavior analysts in general have this idea that oral motor is like putting peanut butter on the side and putting your tongue over to lick it. That's not what Talktools is. Talktools is a systematic way to get, like, if a child can't, like you said, close their lips, or they can't kind of half smile for the E sound, then they're not going to be able to produce it. You can't just take your fingers and pull their lips out. But through these talk tools, through straws, blowing bubbles, biting on block, kind of chewy, like not handing a kid a chewy tube for sensory things. It's systematic biting, blowing.
It's all very systematic. And really, I often look at the individual child. I don't just put a generic Talktools program in. I look at the individual child and say, what behaviors have they got and what behaviors have they not got? And then based on the behaviors that I'm not seeing, and typically I very much think of it in the same way as you would with like precision teaching and 6+6, on when you're looking at the fine motor and the gross motor skills.
Okay, so a lot of my listeners aren't going to know what a 6+6 is. So can we back up to that? Because I have had lots of fluency precision teachers on the show, Rick Cabina, Janet Twyman, among many others. So we can link those in the show notes. But 6+6 is something that I know about. I don't really talk about. So let's break that down. What is the 6+6?
6+6 is basically a selection of movements looking at gross motor and some fine motor with the hands. So squeeze, reach, grasp and release. They're all different movements. And there's actually been a study to show when they worked on those movements in isolation, the self-help skills improved, because you need all of those to be able to do the pinch action, etc., to be able to do buttons and all of those types of things. And so that's really how I see Talktools, is that we need to be able to open our jaw without our jaw sliding all over the place. An awful lot of children I see, their jaw is sliding all over the place when they open their mouth. So that's why you were talking about the bite blocks and the chewy tubes are very much to strengthen the jaw if we've got a jaw that's moving all over the place, because a jaw sliding left and right, when you then try and elevate your tongue, is not going to be stable enough to get all of those other fine motor movements that we need for speech. So I look at it, we need fluid jaw movement. We need to be able to close our lips. We need to be able to open the jaw to the height needed. We need to be able to move our tongue, to elevate it, to get your alveolar sounds and your palatal sounds. You need to be able to retract your lips, round your lips. So there's all these very specific movements we need. And if a child hasn't got each of the movements, they're not going to be able to combine the movements to then make the speech sounds. So if you're looking at, you need to have a lower jaw height, you need to have your lips open, and you need to have that stay stable while you then elevate your tongue to the alveolar ridge to produce the sound And then you need to also understand the difference between voiced, voiceless, and nasal, and know which of those to use at which times, because you've got and then you've got the jaw and the lips and the tongue are doing almost the same thing, but one's going nasal, one's going oral. So really Talktools is about checking, can the children do all of those movements? Because then each of those movements has to be combined in different combinations to produce each of the speech sounds we need. And yes, there is a lot of flack for it, because people think, well, all motor, it's random straws, it's random horns. It's certainly not. If I use horns, I'm working on specific things. What am I using the horns for? And oftentimes I'm working backwards, going, what is the behavior the child can't do? What are the tools and techniques I can actually use to be able to prompt that child? And then, as with any prompts, I'm trying to fade those prompts out and make them less intrusive until I can get them to the imitation, or eventually to the echoic, because we're always thinking function, function, function. How do we get it into function as quickly as possible?
Yeah, and I remember when I got back from the UK, I started my online course in March of 2015. So we are just celebrated our 8-year anniversary. I came to the UK, I believe, in about May, and I was already in, quote unquote, into Talktools. I had learned about it. I had met the creator of it. I'd even tried to do a little bit of research on it. But then when I got to the UK to present, you and a few others, Max Kirk was there. There was a few other people, mostly speech pathologists, I think, and you and some other behavior analysts who were really into it and certified and all of that. So when I came back, we we started using it more with the speech pathologist that was on the cases for, because I had started my course, but I was still seeing clients one-to-one, including Jack and Cody, which they're in my courses and I have permission to talk about them. But Cody, for instance, he had a big problem with drooling. And I didn't realize that Talktools was amazing for drooling. And he was drooling. He was probably 4 at the time, and he was drooling for, years. And with some pretty simple Talktools methods and 15-minute sessions of Talktools a day. That's the other thing, is it's not like you hand them this bite block and they walk around. It is very systematic. Okay, now it's Talktools time, and it's sitting in a chair, and it's and you can't do it if a child is resistant or has any problem behaviors. So I mean, everything is shaping, and it's very gentle, and that's super important too. And then we also had Mags Kirk do a couple video consults with my client Jack, and he had major feeding problems too, not chewing and swallowing, but the sight of mushy food, utensils would freak him out. So he just looked like an extremely picky eater. But the problem is that, well, one of the things I've seen over the years is that if you see an extremely picky eater, or somebody that's not doing well, or not progressing off of a bottle or weaning, or progressing from soft baby food to crunchy foods, or insisting on crunchy foods and nothing mushy can touch their mouth, a lot of times that is very much related to their issues with talking too. So Talktools is not just to help talking, it's also to help things like drooling and feeding. Which in my latest book, Turn Autism Around, the chapter on feeding at chapter 10, worked with Keith Williams to review that chapter, provide additional resources. But there's actually a 2019 study that shows that that picky eating and feeding issues can be a diagnostic factor for autism. And I'm sure you see it in your clinic all the time. Feeding and talking go hand in hand.
We get referrals a lot for, children that we're told that it's behavioral, that they're storing their food. And, particularly those children who are storing their food in their cheeks and things, it's often actually because they can't chew properly. They can't lateralize their tongue properly. They can't move the bolus around to get it into between their teeth. So they're holding it in there, waiting for saliva to break it down a little bit to then be able to swallow. And you see those children that are packers and packing it in. And again, often it's because they haven't got enough range of movement with their tongue to be able to move the bolus around. So they're packing it in so as they can push the food to the back of their mouth to swallow. So we see an awful lot of children that are referred to us for behavioral feeding, when actually we have to go further back and do some oral placement work and make sure they've got all the actual behaviors they need to feed. Have they got chewing? Have they got appropriate jaw strength? Have they got appropriate tongue lateralization? We need to get all of that done first to make sure they're safe to feed.
Yeah, and we also, and I interviewed Melanie Potok, who is a feeding expert, and she has a lot of great tips too. We can link her in the show notes. But yeah, so I mean, I feel like you and I, Risca, were, hand in hand, like we totally agree on Talktools, especially for children that have speech issues, that have that are not vocal or minimally vocal, that can be used for articulation issues, drooling, and feeding. So where's the research?
So that is what we're working really hard on. I'm glad you asked, because we are working really hard. I mean, when I was looking at speech interventions for Dan, I was actually really quite shocked and upset to find a study back in 1968 that was done in London, here in the UK, that looked at tactile cues to prompt speech sounds and operant conditioning. And I just thought, wow, back in 1968, collaborations like that were happening and came out with good outcomes. And yet that research, where is that research now on using these tactile cues and things like that? So we actually were very fortunate to get a European grant. This was prior to Brexit, but it's still happening at the moment. We've still got the grant money up until October this year. So we had a 3-year fully funded PhD student. So we've actually got a PhD student in collaboration with the University of South Wales and their ABA department. Richard May is the supervisor there. And they've been brilliant, really supportive. And this research grant is called a KES2, and it's about bringing universities and businesses together to do research on something that the business chooses. So, of course, we chose Talktools and ABA. So we've actually collaborated with a school in London, in Ealing, a Blooming Tree School. And they've actually got a behaviour analyst there that has just gone through certification in Talktools. And she'd approached me, Alice Carricky had approached me and said, could you give me some supervision on implementing this with some of our children? And I sort of said, well, actually, we're looking for a place to do the research so as we can really control the training and making sure the fidelity of the interventions. So we are working with them to implement the Talktools. We have got extended baselines and randomizations and all sorts to get good experimental control. And Sophie Bradbury's our student, and she's worked so hard. She's, spent so long. During COVID was when we first got the grant. So she was having to work on it a lot in isolation at the time, and did all her sort of literature reviews and everything, and really got to grips with what Talktools is all about. And now we're in the intervention phase. So we're currently taking data. We're due to finish taking the data in July, and then Sophie will be writing up then hopefully for the next few months after that. So, don't know what the outcomes yet will be, but the children are starting to make some good progress, which is very exciting already. Quite a few of them have got new sounds and things. And the interesting thing is we're actually doing it with a selection of non-vocal children and verbal, highly vocal children, but that are missing some sounds. So it'll be really interesting to see what the results are with regard to, the different effects that Talktools might have with these different range of children.
I know when I came back from the UK years ago, the speech pathologist that I was working with didn't know much about it, and she did get online training, at least to the first level of certification. Is that first level of certification still available online, and is it still available for people that are not speech and language pathologists?
Yes, so they have got, they've just relaunched their certification actually. And so the course that I co-teach with Renee Roy Hill for them about ABA and Talktools is part of the optional package now for level 2. So you can get level 1, which I believe now is sort of 2 courses, an introductory to what used to be called the 3-part treatment plan, and then program planning. So that's level 1. And then you go into level 2 where they look at feeding, but also then you can take optional units in the for the populations that are most relevant to you, because Talktools has got sort of courses now for adults, that may have had strokes and things like that as well. So there's certainly different levels of certification. So there's level 1 and 2 that can be done online. Level 3 they have been experimenting with online, but often it has been done previously in person, and then level 4 has been done in person. So I'm level 4, but specifically for autism. So a sort of limited level 4, if you like, because I'm not an SLP, I am a BCBA.
And most of the people that do the certification are SLPs.
They are SLPs, yes. But, we are, as I say, looking at different options, because the way I use Talktools completely adheres to the 7 dimensions of behavior analysis. And so, now with this research and how we are refining the data collection on the exercises and things, that certainly we're looking to make it more accessible to behavior analysts, so as actually we can look at it with a behavior analytic lens.
That sounds fascinating. We'll be interested to see the research, and maybe we can, in the fall or winter, whenever it's published or available, we can add that to the show notes. So if you're listening now, you can look at the show notes. We're going to have anything we mentioned linked there. And I do want to say that it is something that you need training on. You can't just, go out and buy the Talktools stuff and start messing around, because you really do need to know what you're doing. The other things you can do, if this sounds a little bit too overwhelming to just tackle right this second, is I think if you read the Turn Autism Around book, especially the chapters on talking and the chapter on feeding, you will get some ideas about ways to, bottles and pacifiers really do need to be weaned. We need to look at, getting kids not to graze all day, to be eating and drinking things with calories throughout the day so that they're not hungry for meals. And just, I have a easy, medium, difficult food list that you can easily do, just kind of things you can do to have your child eat better. And, if they are still on a pacifier or bottle after age 1, or they're still on baby foods, pureed, that is part of, you need to progress. And if the child is not willing or able to progress, then you need to seek help and seek an evaluation at a feeding program, or at least talk to your doctor about it.
And that is really important. I remember attending an ABAI presentation by Piazza, and her title was "What You Don't Know Might Harm Somebody." And she was actually covering things like, she showed some videos of you using chewy tubes and things, and saying you need to get the oral placement measures checked. So even for us as professionals, and that's really where I ended up looking down this route, is because, I wanted that collaboration with the people that knew what to do, because Dan had major feeding issues at the start of this as well. He would nibble tiny bits off food, and we were treating it behaviorally. And then I worked out, oh no, actually, he hasn't got the skills to be able to do it. And so, through finding Talktools to help with his speech, we helped with his eating, to the point now, where he'll eat anything we ask him to, and he can handle it all and eat it all proficiently.
Yeah, that reminds me of like little Jack that we had Mags Kirk do a little bit of video consultation. Was he refused utensils? Like, he could finger feed, chew, swallow. So you were like, what's going on here? He refused utensils. And that was because he couldn't get his lips around it and get his lips around to clear the spoon, which is a Talktools kind of skill and a language kind of skill. We started out with a corn chip on a spoon and progressed from there. So I have a bonus video in my courses on, with these videos showing exactly what we did. Again, we didn't, I don't think we have any videos of Talktools. We might, but for the most part, I just say, be aware that this isn't all behavioral. If a kid's screaming with utensils, it could be a lot more.
Yeah, Talktools have side feeding spoon programs, and then they have front feeding spoon programs. And yes, so many children cannot round their lips and get that seal to be able to clear those spoons. And so they've got techniques to actually prompt those behaviors.
Yeah. Yeah. Well, you sound like a wealth of information, especially with this area, but I know you have expertise, in your center does verbal behavior, you do peak, you do RFT, you do so many things. And just 8 years ago when I was there, I was super impressed just by the people in the audience, and by the collaboration and the positivity that has always been just a part of you and your team. So thank you for sharing all that knowledge. Before I let you go, I want to ask a final question. Part of my podcast goals are for not to just help the kids, but help the parents and professionals be less stressed and lead happier lives. So you're a mom of 2 boys. You've got your foster brother, Dan. You have a farm, you have a center. How do you keep yourself less stressed?
It has to be acceptance and commitment therapy. It's always the science, I'm afraid, Mary. It's no easy answer. I do find myself using ACT every day. So as you said, we use RFT, we use PEAK, we use acceptance and commitment training or therapy. And I literally use it on myself every day. I have to use all the different techniques.
So I did do a session with Jonathan Tarbuck's on ACT. We can link in the show notes, but just quickly, how do you use ACT every day? Like what?
Yeah. So I have my values listed on my phone in my notes. So as if you have worked your values out, if you've identified what's important to you, they're your long-term reinforcers. So when I've got to make tough decisions and do tough things, I can easily refer to my values, and I literally refer to those on a daily basis. I use a lot of diffusion techniques, a lot of present moment techniques. So, your mind is there to beat you up. I am constantly got the guilty mother. Am I doing enough? And all of the rest of it. Oh, I've missed this, or I can't do this at school, or I can't spend every holiday with them. So the guilty mother story. So I use a lot of diffusion techniques like naming the story, and I use a lot of present moment, a lot of committed actions. So making sure when I'm looking at my values, right, what are the actions I'm doing this week towards those? And yeah, it's a lot of that. Every part of the hexaflex, I am constantly navigating it around. And the Joy of Parenting book actually was a really good book that I read recently on holiday. And it was just so brilliant to read that book, to know how to use it with my children, as well as in work and everything else. But yeah, it all comes back to the science of behavior analysis. I'm constantly using the science in all its ways, shapes and forms, whether I'm in work or out of work, and managing, yes, my own mental health and everything. I don't know how I would do it without the science, to be honest.
That's great. That's great. All right. Well, I will let you go. Thanks again for all of your time and expertise, and wishing you the best, and can't wait to read the research once it comes out.
Thank you, Mary. Lovely to join you today.